Well, public health and playing politics, new restrictions and growing anger, all doing a number on hard-working people, trying to figure out how not to wind up at a food bank or in a hospital. The ugly truth is that this second wave of COVID-19 cases is hitting Europe like a tsunami. Take a look at these numbers. Leaders frantic, trying to get a grip on the intensifying crisis that you see reflected here. In Germany, nearly every major city in the country is now a virus hotspot. Stuttgart asking the military for help fighting the pandemic. And we will hear about new restrictions very shortly from the British Prime Minister, Boris Johnson, about to unveil a three-tiered system of alerts for England. And that is not without controversy. Our correspondents are tracking developments across Europe for you. In fact, they are in the sort of nerve centres of power, as it were. CNN's Nick Robertson standing by for us outside 10 Downing Street in London. First, let's get you to Scott McLean, who is near the Reichstag in Berlin. What is the story there? What's the feeling on the ground as well? We keep reporting these numbers, and certainly, Scott, you know, the picture is very worrying. How are people feeling in Germany?
Hey, Becky, look, Germans have been quite good up until this point of following all of the coronavirus restrictions, but there seems to be a bit of a fatigue setting in as to what they can and cannot do. And you can certainly understand that. Germany had one of the best coronavirus responses in Europe. It seemed to have tackled the virus this summer, was quite good, with cases quite low. The death toll was a quarter of what the UK had recorded. It was even sending ventilators to other countries because they had a surplus. And so Germany had all the reasons in the world to do a sort of coronavirus victory lap, but now things seem to be getting out of control. Almost all large cities in this country are now considered coronavirus hotspots. Stuttgart is even calling in the military for help. And here in Berlin, well, this is the hottest of hotspots. In fact, not nightclubs, but bars and restaurants have had to close early starting just this past weekend because of this spike in cases, which is quite the blow for a city which is really famed for its nightlife. Today is also the beginning of the fall break, so 2 weeks off of school. You would think that this would be prime time for Germans to go on holiday, but right now it's not so appealing to go abroad given the web of rules and quarantine restrictions in other countries. It's also not very appealing in many cases to go from a so-called high-risk area like Berlin or like some of the other big cities in this country to other parts of Germany even, because each state makes their own rules and it is a real hodgepodge. And so in some cases, the states or the areas require you to have a negative test within the last 48 hours before checking into a hotel room. In other cases, you have to have that negative test and then also quarantine on top of that. So that is leading to really long lines at testing sites in these high-risk areas like Berlin. It's also leading to a lot of cancellations in some of these tourist destinations. The health minister has warned about the uncontrolled spread of the virus, but at least from what we heard today from officials, Becky, it seems like a second nationwide lockdown isn't so much on the agenda because, like the UK, this government's priority is getting the economy restarted and getting schools or keeping schools open.
Yeah, Nick, look, the picture across Europe is an ugly one. The story in the UK, it seems equally as alarming. There does seem to be a drip feed of incremental restrictions across Britain, none of which seem to be working out. I mean, when you consider that these numbers continue to rise, is it clear what is going on in the first instance? And secondly, what is it that the Prime Minister is about to announce? I mean, these are restrictions specifically for England. Will they be reflected elsewhere?
I think you could say that they've been preempted to a degree in Scotland, in Northern Ireland. The First Minister, Deputy First Minister over there talking about having a national lockdown. So again, Northern Ireland may be before the UK. What the Prime Minister is expected to announce today will bring clarity to what has been a series of different regional and local lockdown measures that have been frankly confusing for the population, confusing even for the Prime Minister at times. So 3 tiers that is expected to introduce today: medium, high and very high. We still don't know what it requires to hit one of those levels, and we don't know what it means if you hit one of those levels. We know that the city of Liverpool, for example, will be at the highest level. That's what Liverpool's expecting. There, the gyms, the pubs, the casinos were shut down. Will the restaurants shut down? That wasn't clear this morning. That's been debated. We know the Prime Minister's going to come out of here shortly on his way to Parliament, so we will begin to find out in the next half an hour what he plans. But we've heard from medical officials earlier today, and the medical director of England for the National Health Service was very clear and straightforward in his warning for the population. This is how he laid out what it looks like right now.
It is a sad truth that whilst we've done much to improve the care of those who are infected, and while scientific research continues apace, there is still no cure nor no vaccine for COVID-19. That means, sadly, as the number of those infected increases, then so will the number of people who die.
So you've had 3 of the emergency overflow hospitals put on standby in the north of the country, and of course the criticisms the Prime Minister has faced and the fine line he has to walk is that local councils have been saying exactly what you were saying, Becky. Show us the data that tells us what we're doing is correct, because in some areas lockdowns have been in place and or partial lockdowns have been in place, but the infection rates have not been coming down. That's in some areas. So there's this disparity between what local authorities want and also how they think they can contribute to what the government's doing and the decisions it's making and how they can help out in test and trace. So this is a very difficult, fine political line for the Prime Minister to walk, and business is a big part of that, Becky.
Nick, very briefly, we've been talking for some time now about this sort of complacency, this fatigue with restrictions that has sadly allowed for this spike across Europe. It has to be said, you know, no finger pointing at any one country at this point, because it's a mess all over the place. As the Prime Minister gets set to announce these new measures, this new tiering of restrictions, are people taking this seriously?
That was the intention of the announcements by medical officials earlier today. The reality is that there is a sense, and you see the pictures and the videos show up the day after when pubs turned out in London over the weekend. There were people playing a game of cricket in the street, for example, and fingers have been pointed particularly towards the younger community. But the point being made by officials today was we cannot really believe that we can allow young people to mingle and go out and drink and have fun and be infected because they have less likelihood of dying, and believe that won't touch the older population. And medical officials are saying infection rates are on the rise in the over 65-year-olds, in the over 85-year-olds are on the rise. They just say it is ridiculous to think that we can try to pretend one part of the population can do one thing and another age bracket of the population can do another, because they will be affected. And again, this is a dilemma facing the Prime Minister.